Welcome to Flourishing in Medicine from Surviving to Thriving. I'm your host, Dr. Mick Krasner. This podcast is brought to you by EmPro, a medical professional liability insurance carrier located in New York State. And EmPro has been committed through educational activities and peer support activities to support the physicians that they cover and they protect.
Thing that I have learned the most, I think, has been to really embrace the embodied self. And it's more than the mindfulness and more than kind of that moment of meditation or kind of rest, but it's really saying there is information in my body, there's information in my spirit that is going to come out. And how can I call that to my attention? How can I name it? And then make a deliberate and conscious choice about what to do with it, which I wish, that would have been at times when I was at my busiest in practice would have been a really helpful thing to be more meta about. But I think it's easier now that I don't have as much things to rush to. I can build space, and that's a gift that I've given myself of time. But I would say that has probably been the most valuable thing. And the other thing is letting go of outcome. I would say really letting go of fear of outcome and letting go of outcome itself, what I would say has been a gift of being trained as a coach, because that's, things that things will change. They're going to change naturally.
Today on Flourishing in Medicine from Surviving to Thriving, I'm joined by my friend and colleague, Dr. Ellen Singer, an internist and pediatrician with more than 30 years in clinical practice and medical leadership, and now works as a physician coach supporting clinicians across a large health system. I've known Ellen since residency days well over 30 years ago. In our conversation, Ellen traces the early influences that drew her to medicine, and then we explore what happens when the culture of perfectionism, overwork, and resource constraints collides with the desire to give excellent care. We talk about why coaching can be such a powerful tool for getting unstuck, not by handing people solutions, but by creating space for clarity, boundaries, and alignment. If you've ever felt the moral distress of knowing what your patient needs while navigating a complex system, I think you'll find Ellen's perspective both grounding and hopeful. Let's get into it. Well, Ellen, I am so excited to have you here. Welcome to Flourishing in Medicine from Surviving to Thriving. Knowing you for all these years, welcome to the podcast.
Yeah, well, thanks, Mick. We've known each other a long time, 35 years or more, or something like that. So it's good to reconnect with you in this menu.
Before the coaching, before the leadership roles that you held, if you could just tell us a little bit about a part of your story that led you toward medicine.
Yeah, cool. I think it's a great question. And I'm a big fan of those kind of stepping stone experiences, the things that take you from one point to another. And I think I was really fortunate in that I had 4 adults in my life. I was the oldest of my generation in my family. And my maternal grandparents and my parents, I think, both kind of gave me an individual gift. And I guess we get the best and the worst of our elders and parents, but I think I really probably got the best gifts from each of them. And I feel kind of like each of those got me in the direction of looking at medicine as a career. And I think each of those gifts kind of sustained me in my career. So I would say my maternal grandfather was a man who had no college education, was this very generous soul and spirit, and could meet anybody and figure out what they needed or wanted, and then would figure out how to get it to them. And that was modeled over so many years in my life, and was so, I think, instrumental to me that became one of those values, that this is just something so important to do, is to hear somebody's needs and be able to say, I think I can help. What can I do to help? My maternal grandmother was his partner in life for many years. They were actually born on the same day in the same year, which was kind of cool. But she was the most organized, most systematic, and most kind of optimizer kind of humans that you'd ever met. And she also had this deep sense of when you do something, you do it right. So I think that I got that value of focus, get it done, do it in a really excellent way, be proud of what you do, finish it. And so I think that memo also has really helped in my career. My dad was a mathematician, a little bit scatterbrained, but really one of these people who could take a complex problem and solve it down to the very last equal sign. Somebody who had this deep sense of social justice, so that was always in there. And also, I think just this deeply curious person about the world. And so I think that was something that was also just infused as that this was important to do and to be able to really have the tenacity to take a complex problem and break it down. And my mother was actually truly a social scientist. I mean, her PhD was in what people remember from cocktail party conversations. And so I think my early childhood was kind of infused with thinking about animal behavior, how systems work, how humans work together, how humans do terrible things to each other and why. And I think her biggest value was really in the story behind what was going on with somebody. And she wasn't, I think, always as good at being empathetic about the story, but she was really curious about it. And so I think because I had these four people in my life giving me each these little different ways of seeing the world, that's what drew me to the kind of work that I do. And I would, now that I'm, 30 plus years into it, I would say that's what says this is why this is the greatest job in the world, because I get to live the things that I valued the most every single day.
I'm also interested in when, because I know a lot about the work that you've done over the years and the trajectory of that work and the interest in the inner life of clinicians in particular. When did you first become aware that the inner life of clinicians was important, or when did you just first become aware of your own inner life as a clinician, not just of our patients, of course, that we ask those questions, but of ourselves and our colleagues?
Oh, I think that was before medical school for sure. So I started college at one university and transferred to Berkeley where I graduated. And in that work, became a writing tutor for several years, working with students who were struggling with Subject A English and English 1A, and did both individual and group tutoring. And I learned a lot about how people think because I was helping people write personal essays and helping people with their concerns about college. So I had done a lot of work with tutoring through my high school and earlier college career, but that was a really instrumental shift in my ability to, I think, teach from that meta level, but also have to address my own story and to get really deep within writing personal essays. And I actually took a pretty intense seminar in personal essay writing. So that I think was always kind of part of who I was. And again, I think my mother was that person who was like, you have to understand this. You have to know this about yourself. You have to figure out how to get through the world in this way. So that was part of where I came from. I think when I was in medical school, I was really fortunate to be accepted and to matriculate at the University of Rochester, which was so heavily focused on communication, doctor-patient communication, medicine in the context of how people live and work, and that was as much part of the curriculum as anything else. And so I was really just deeply immersed in that. And I think within my own residency training, was very well mentored to have safe spaces to process, both with colleagues and peers who I'm still very close to, and then also with faculty, and really had a network. And so felt like my medical education and my residency education, which was definitely by choice because I ranked Rochester first for my med peds residency, I feel like gave me the best chance at being immunized against burnout as much as possible because I really was taught the skills for self-reflection skills. And I was incredibly fortunate to be part of a cohort probably after you finished residency at the U of R in our program where we did an entire month rotation on the doctor-patient relationship, including self-reflective work, group dynamic work, project work, and had that in the very middle of my third year of residency, a time when I had a 5-month-old infant and was probably needing that space more than anything. And I really see that as kind of a pivot point or a hinge point in my residency that really amplified the skills that I think I had intrinsically and solidified them. And so I would wish and hope that anybody in training would have that kind of experience. I don't think that that's especially available, and I do think residencies are missing the boat on some of that, but I was super, super lucky to have that time and to have that space, in the middle of a very intensive 4-year program.
You took that basic training, we could say, and turned it into a very successful, long, and fruitful career in clinical medicine. But at some point, more recently, your professional identity expanded. It sounds like from what you've told us so far, very naturally to coaching, include coaching. Can you just walk us through how that evolution unfolded over the last number of years?
My coaching practice, I've been certified as a coach now for 3+ years, and my coaching practice was built, I think, out of a pre-pandemic intentional decision as to what I was going to do when I eventually retired. Because, prior to COVID kind of stopping the world and changing the world dramatically, I was very busily managing a med peds primary care practice with a sideline of eating disorder clinic, which I'd been doing for several years. And at the time, I had just transitioned from being the internal medicine ambulatory chief for Northwest Permanente with probably 120 internists, and I was in charge at that point of hiring, retention, recruiting, quality improvement, education for that cohort, plus adult primary care. We were kind of really focused on merging family medicine and internal medicine into an adult primary care consortium, essentially, so that there wasn't any competition between those two specialties. And I'd been doing that for many years and then transitioned into being the GME director for Northwest Permanente, so handling all of our educational arrangements with multiple medical schools and with 35 residencies working in our system. We have about 600,000 patients and about 1,400 licensed clinical providers. So it's a pretty big operation. It's not the biggest operation, but it was a place that I had worked for many years. So within that setting, it was a really good career and a really, really great job. Busy. I'm a big believer in 5-day work week. So I was in clinic 5 days a week, part of each day, because it's just easier to take care of your patients every day. But I knew that I needed to have something to move to after I retired, that I wasn't going to retirement for me wasn't going to be sitting around. And I really wanted to make the use of a stretch of time in my 60s and 70s as much as possible when I was healthy so that I didn't have an empty space. And I also didn't work up until I was too ill or frail to work, having seen that happen to colleagues and actually to my family. So in the middle of all that, I won this huge award from National Kaiser Permanente, which allowed me this stipend to do whatever I wanted. And I won that on March 6th of 2020. And then the pandemic hit. So 2020 and 2021 became my COVID is everything and anything world. But I very quickly took on managing ambulatory COVID operations for our organization, including some educational work with medical students in the very, very early days of the pandemic. And then I became the expert in all things related to employee health and COVID, and then all things related to post-acute sequelae of COVID. And by the end of that, I was pretty crispy. And so at some point, I was told, you have to spend this money down or you're going to lose it. And I said, there's no way I'm going to walk away from all this money. So I said, I'm going to become a certified coach. And that would be the right thing to do in retirement. And just beautifully, I found an outstanding coaching program. And just as I finished the curricular work for that program, the core curricular work, I was asked in another capacity to design an internal coaching program for a competing health system, and they were bringing back internal coaches for physicians. And I wrote the job description and helped them with their strategic design. And when I saw the job description, I said, "Oh, that's the job I was coached
Yes.
into retiring into." So I applied for it and I got it. And that pulled the ripcord on this career pivot, which has been pretty phenomenally great, which I think I work coach for a legacy health system, which is a competing health system with 6 to 7 hospitals, depending on how you look at it, and another 14 or 1,500 licensed providers associated within the system, some employed and some contracted. And I'm one of 2 physician coaches for this organization, and it's a real gift. We provide free on-demand coaching services from everything for distressed physicians, behavioral issues, group coaching, as well as leadership and life coaching. And I have a wonderful practice partner in this work. We're expanding to probably bring on a 3rd coach, and it's a fully funded program. So it's a great part-time job, and I continue to do clinical work in a variety of other capacities. And it was an unexpected career shift at the time, not something that I had ever thought through or planned. But I would say my learning from that is that I found a way to kind of rebalance my portfolio of how I spend my time and have control over my time, which has just been a wonderful gift.
One could say 5, 10, 15 years ago, coaching would not be really a traditional part of one's medical career for most clinicians, physicians. And I'm just curious about, in what ways did traditional medical culture feel insufficient for the kinds of conversations that you're having now, or maybe you had a intuition that you wanted to have into retirement?
Coaching is difficult to do as a physician, and there are a lot of physician coaches. There's an entire network, and it's interesting to think why this career why do individuals need so much help and support, and what can we do to maybe learn to coach ourselves better or give ourselves the space and grace to kind of be in the world and not feel like we have to do so much in the world. Medical culture can be pretty tricky, I think, at times. It's a perfectionist culture. It's a culture of overwork. It's a culture of denying one's needs. Sometimes it's a culture of not knowing how to set boundaries and limits and trying to do too much in one day, all of the above. And then there's also the demands of workflow and in basket and the complications that systems have that make it easy, sometimes make it easier for clinicians to get things done, sometimes make it easier for patients to get care, but require this degree of attention and focus and understanding of the interconnectivities of a complex system. So all of those are reasons that I think people get stuck in medicine. And I do think coaching can be really helpful for getting unstuck or getting above the fray of all of that to try to figure out both what is it that an individual or if I was being coached, would want, and how do I want to show up? Well, what is it about the showing up? So I think in my own career path, even since I was a resident and a chief resident, I have been involved in helping people who were struggling to kind of get through the day, understanding, especially I think I learned this deeply as a chief resident, that what you see on the surface is often not what's going on behind the scenes, and that physicians struggle with all the same things that human beings struggle with, whether that be substance use disorder, mental illness, physical illness, depression, fatigue. We're all going to have that. So in leadership, it's important to help colleagues and help people that you're supporting get to the care that they need. So I think that that's always been a part of my role. I've always had some kind of leadership or kind of supervisory role during my career path. Coaching is a pivot from that. And the trickiest part with coaching, I think, as a physician, is as a physician, we are trained, especially since I'm an internist pediatrician, but as a generalist, we're trained to hear a story, collect evidence, set up a hypothesis, come up with a variety of treatment plans or systems or solutions for somebody and offer them. And coaching is completely solution free from the coach end. And it requires really saying, what are you going to do about it? Where are you going to go with this? You're stuck. How do you get yourself unstuck? So that I think has been both the blessing of learning that, and also probably the biggest challenge is kind of leaning into that and really believing that and not moving into the solutioning role. And internal coaching, the kind of coaching that I do, has a little bit of that stickiness because there are times when I'm asked to come in and really help remediate somebody, get them up to speed with their in-basket work, get them up to speed with their meeting style or meeting management or something so that they can stay in. And that requires kind of pulling out of the coaching role and saying, you really can't be you here. We got to make a change, and I'll help you make a change. And so coaching is kind of, I see it as kind of a wider continuum of all those things. But I think the truest form of coaching is you're here. Where do you want to go? And I'm going to just be there as a help you figure out that path. I'm just going to be here. And that is a really fun space to be. It's a really wonderful space to be, but very different, I think, than in medicine. I do wonder what's going to happen long term. I think at some point we can't have physicians leaving the workforce to become coaches as an off-ramp to the difficulties of a career. And I would say my biggest passion is trying to help figure out ways that the system allows people to find joy and purpose and meaning and reasonable work pace and provide really exceptional value-based, population-focused healthcare, so that we're giving care to the right people and we're doing work that really matters. Those individual little interactions add up to something very big, and kind of making that mosaic of care work is there. So if we need coaches to get us to that point, go for it. I don't think all of us telling each other to say, hey, let's just cheerlead you on and like letting it be the mess that it is the way to go in terms of fixing or improving the care delivery for this country.
Among the most clearest articulations that I've ever heard, you've described without judgment sort of many of the challenges that face clinicians. And you described the approaches that we have to our patient care and the way we think, but also how presence is a different way of working with problems and working towards solutions when you're working in relationships. So thank you, thank you for that. That was just really beautiful. Much of your work, you've hinted at it, and I just want to ask you a little bit more about it. It unfolds in moments of vulnerability, especially when you're working with those who are struggling. You talk about privilege restrictions that affect physicians, conflict, burnout. Help us understand what that terrain looks like from your vantage point as a coach with the background that you have.
Right. So I work in a system where our physicians are credentialed at individual hospitals. They're moving towards hopefully a more universal credentialing process. But one of the reasons that my current coaching role was funded was to help deal with conduct concerns and conduct issues within the system. And conduct is kind of a vague term, but there are definitely kind of clear descriptions of disruptive physician behaviors. And those go back actually to the New York City Medical Society of like the 1900s, the first one. So I've researched that a little bit. But the stress points that a lot of times the stress points that our clinicians get themselves into have to deal with how they're showing up in the workplace, their response to a challenge with patient care, to a time restriction, to a resource constraint. There's often a lot of concern about like who's getting funded for what, where money is going. Time is a resource. So like how much OR time I get, things like that. And there are times when people, and all of us are going to blow a gasket and lose our temper when we're told we can't have something that we think we need or want. That's probably the most common conduct kind of issue that we see. There are other situations where people are coming to work with significant medical or substance use concerns. That's a whole nother issue. And then there's also issues where people are just not getting their work done because they have either too much work to do but usually they have a lot of work to do and poor focus on the work that they're doing, so they're not finishing their work. So all of those are the typical situations that I have been involved with. A lot of the coaching presence is hearing the perspective of the involved individual so that I have a sense of what their point of view is. One of my roles is to kind of say, is this point of view serving you and where are you getting stuck? What is it that you really want for your day, for your week? What makes a good interaction? What makes a good day? What makes a good week? And then what's helping and what's not? What can you get rid of? What are you willing to change? So a lot of it is in that venue. There are times when I'm asked to come in and coach somebody out of doing something. For example, please stop sending long, secure chat messages around your frustrations with your coworkers in secure chat as a back and forth, because that is not how we communicate in the system. And at some point, you got to just say, that's not how we communicate in the system. So some of my work is coaching the leaders to just be more leader-like and actually kind of put their foot down on what are the interpersonal and interprofessional behaviors that we would expect in an organization. Kind of what is a learning organization in terms of how we work with each other. Those are the situations that the most common coaching ones. I think the presence, a lot of it is acknowledging that everybody struggles at some point with something, and it's how we kind of move past that struggle that gets us through that. And that doesn't mean that I have to self-disclose what my own struggles have been, but I think being a witness and saying, you know what, we've got this. Let's try an experiment. I was a chemistry major in college. It took me a long time to understand like how chemistry relates to my life, but it's like, let's just do a little experiment. Let's just put a reagent in and mix it up and see what color we get. That would be really fun, wouldn't it? Let's give it a try. So let's set a timer and see if you can get your note closed in less than 2 minutes. Oh my gosh, you did it. Go you. Those kind of things.
The first category of issues that you work with in coaching that you shared, I would agree with you that they're common, and they, in my mind, at least the way I think about it, I think about moral distress. I mean, these are issues where you could do something, and it's usually related to good patient care that you'd like to be part of. And for whatever reasons, there are barriers, and that gets quite frustrating. And you
Yeah.
keep running into these barriers over and over again. That's one form of trigger for moral distress. I'm also wondered if you could share if there are narratives that you hear repeatedly that concern you. What are they? What are the ones that really have you most concerned about our professional lives as physicians and clinicians?
I definitely think that sense of I'm doing the right thing for the patient and I know what I need and you need to get it from me is kind of one of those resource constraints. The biggest thing that I think has happened in healthcare since I entered the workforce, and I'm going to say that as a caveat, I've always been an employed physician, never have been a self-employed physician, is that we have basically a workforce of employed physicians working in systems that have employment contracts and incentives that can be very beneficial to us, but also have roles, expectations, and targets or incentives, whatever it is that we have to meet. And so the biggest common stress is who's in control of the budget? How do we follow the money? How do we make sure the money is going to places that really improve patient care and don't just fluff up the system with administration? When we have administration, what does that look like? And what is healthy administration? And physicians don't understand that budgeting is a values-based operation. And often they're not at the table when the budgets are cut. And so they're responding, or the budgets are made, they're responding to that. So there's this constant battle for kind of resource and the economics of care, time being also like a metric, or time being basically a form of compensation or money. Yeah, money, and figuring out how we use time. And so there's this sense of I know what I need, and you're going to just give me everything I need, and not understanding that there are resource constraints on the system, or that the system has been designed to not value and respect the work that physicians do, or the time that it takes to get the work done, so that you can't treat physicians like there's somebody putting grommets in shoes, moving down an assembly line. there's a degree of flexibility that's needed for good patient care. And I think that has become this tension around who controls time and money has been the biggest struggle for our workforce. And I would say in general, understanding how to negotiate and then how to understand how to save for future us, how we set aside resources for later, how to figure out what to invest in and where to put in money up front, how to decide when to withdraw from investments that we have, uh, and how to decide how we redistribute wealth are probably some of the biggest issues that need to change in our healthcare delivery system across specialties and across health systems. And I think that that is what's tripping everybody up.
That's a really clear argument about that. And I think you're right. It is something that does get quite frustrating because you are on one end of the care spectrum as the care provider, physician, clinician, and then there's the other end of where those resources are coming, and you think you should have some input into how resources are being used, distributed, decisions are being made. So, yeah, thank you for that. And because you work with leaders and systems, you mentioned that leadership work as part of the coaching. Maybe if you could talk a little bit about what is it you're trying to change? For example, and I know this would be something you'd like to do or do, is how do you approach transforming a meeting in leadership from something that's just transactional, the way you described the budget and all that, to something that's more relational, which is how you describe how you coach?
I think in leadership, it's such a broad and vague term. So one of my favorite activities and exercises is to really crowdsource what leadership means to the group that I'm in and to really understand the touch points that people bring that says, this is how I know I'm a leader. Like, what is it that a leader is supposed to do? Is a leader supposed to fight the battles for us and then solve it? Is a leader supposed to kind of throw everything into turmoil and then become the hero? There's all these different leadership myths and legends. So it's helpful to kind of understand where that perspective comes from first. So that I think is kind of, for me, in a coach-like role, kind of priority number one is to kind of know what's the story arc here and what are we solving to. The second part is that we do a lot of meetings that don't have clarity around what we're trying to accomplish. We do a lot of meetings where we don't take time to build relationship, to open the meeting consciously or to close it consciously. We do a lot of meetings where we're not clear on who's going to be taking the next steps or how we deal with the behavior when somebody's upset or disappointed. So my role right now in the system that I'm in a coach and in other systems that I work in, is to just model good meeting mechanics and behavior. And to really, I've actually done some training sessions where we model meetings that blow up, where they're personality, where we're doing role played personalities and we really play out the role. So we've got the aged obstructive person, and we've got the kiss ass, and we have the leader who wants to take over the leadership, and we have the solutions focused IT person. And I think the most important message is everybody's important in this meeting, but the personalities will come up in a very they will always erupt. And so once you start understanding how to get to the balcony and see what's happening in a meeting, it's hard to facilitate a meeting well, or it speaks to having somebody who knows what's happening in a meeting to be there to help facilitate the meeting if it's a high stakes meeting. So, I think that those are really important skills. And I think there are just some simple, basic human-centered negotiation skills where you can really learn to hear what your counterpart needs. You can hear their story, and then you can try to say, let's try to figure out a solution. Get like maybe I give up a little to get you something. Let's look for the win-win-win here in any situation. And I think that that's probably the most difficult skill to learn, but probably the best skill to have, and something that one has to be able to see the dynamic of what's happening in a multi-party negotiation to understand how to get past it. And so I think that that's something that I've really embraced, is kind of understanding some of the nuances of multi-party negotiation, how somebody who might have a weak position can get more than they ever thought, and how somebody who thinks they have the best position can lose everything. because they can't win. And so I think it's a complex human dynamic, but I think it plays out with small children sorting out who's playing with the Thomas trains and how we move those pieces around. I played marbles in 4th grade. A lot of it was like, what's the priority of the cat's eye versus the other one? And how do you divide and conquer? So getting really good at that and being tuned into that, I think, is a really valuable skill that many of our colleagues experiment with, but maybe don't embrace as much. And I think being confident with that, but also gentle and with that allows one to be respectful, I think, of counterparts in a setting. And so recognize that whenever you've got 2 people or 3 people, wanting something a little bit different, there's a negotiation happening.
I'd like to just shift a little bit without breaching confidentiality. Could you share a moment that captures why this kind of work that you've moved into matters to you? Something that you witnessed, something that's really tells you you're doing the right thing.
I would say I have worked with a colleague over a couple of years who is probably one of the most dedicated and gifted physicians that I have met in a long time. Somebody who, whenever she puts her mind to do anything, can get it done. She takes on the most difficult and complex patient situations. She takes on more of it than anybody would. And she's also kind of always thinking, how could I get a research study out of this? How could I support somebody who needs my expertise in research? I mean, the generosity of spirit and the dedication to what she's doing is beyond the pale. And yet at the same time has been at times can get very trapped in feeling overworked, feeling overburdened, feeling that people don't respect her, don't take her seriously, dump work on her. So, coaching somebody like that, somebody who is so gifted and so talented and yet so at risk for burnout because of the spread and scope and spans of what their envision is like saying, what's important? Like, how are you going to honor yourself? Where do you need to set limits and boundaries? What can you let go of? What's the image that you want to hold as you think about all these things, whether it's you think about it as like you've got this beautiful you're arranging a bouquet in a big vase and you've got this huge centerpiece and yet it's too many flowers, it's weighted wrong. Like, what are you going to take out? How are you going to rebalance your portfolio of work? And so working with somebody like that over a span of time and seeing them be able to say, I'm going to say no to this in service of this, to me, that's a place where somebody who's really gifted is going to stay in career a lot longer. And I would say that that's been one of those kind of situations are probably the most valuable. The other one that I would say is probably the most valuable is the person who really looks like they are just not going to pull through. Like they cannot get their charts closed. They cannot get their work done. Everybody is pissed at them, and sitting and hearing where their background is, what they're doing, how maybe they can clear their backlog. Let's work together in clinic and see how you're using your time in your day and your focus and attention, and suddenly have them call me and say, you know what? Got all my charts closed every day this week. I've got this, is just the greatest thing in the world. Again, a career save, because somebody who had created some bad habits and kind of dug themselves in, needed a kind of a hand to kind of figure out a path to getting out of the backlog. So the backlog, letting go of the backlog and then thinking about what future me wants, I think has been also a really fun part of the career.
Those are great stories. And our listeners, I hope, will take this, and some of them may even seek out coaching. And we'll certainly give your information in the show notes for sure. Would you be able to just share in what ways this work has changed you as a person, not just as a professional, but as a person?
The thing that I have learned the most, I think, has been to really embrace the embodied self. And it's more than the mindfulness and more than kind of that moment of meditation or kind of rest, but it's really saying there is information in my body, there's information in my spirit that is going to come out. And how can I call that to my attention? How can I name it and then make a deliberate and conscious choice about what to do with it? which I wish, that would have been at times when I was at my busiest in practice would have been a really helpful thing to be more meta about. But I think it's easier now that I don't have as much things to rush to. Like I can build space, and that's a gift that I've given myself of time. But I would say that that has probably been the most valuable thing. And the other thing is letting go of outcome. I would say really letting go of fear of outcome and letting go of outcome itself, what I would say has been a gift of being trained as a coach, because that's things that things will change. They're going to change naturally. You can envision what the storyline might be, but it doesn't have to be that way. And you can go back, you can use your sense of what your body is telling you to kind of rethink the image or the metaphor for what you want, and then decide what kind of aligned action to take to get closer to that. And so that those are the two things that I would say have changed me in the career path. But it's hard to know if that would have been what would have happened in the middle of my busiest years of practice. So part of it I think was intuitive, and some of it is just a little bit more conscious now.
As we finish up, would wonder what you thought is realistically possible to flourish in today's medical landscape. What does flourishing, I guess another way of saying it, what does flourishing realistically look like today in medicine?
A lot of it, I think, is how do really having clarity in small group dynamics or big group dynamics, why we're here, how do we work together, what's our vision for our patients that we care for, what is it that we want, what does it mean to look forward and to say, in 10 years from now, what we did today will really matter, and that we're all on that same path together to do that. I think that that's what healthcare providers want, is they want to know that the work that they're doing really means something and will make a difference. The second part of flourishing, I think, is really finding ways to say, I know how to care for myself, for my family, for my practice group, for my community. I know the little things that I do every day, the habits that I do every day that build care and nurture those individual relationships. And so starting at the small, with the self, and then moving into this next unit, I think is really the strategy for flourishing. It's building in that sustainability, which means get enough sleep. We eat healthy foods. We play with our kids. We attend to our homes and our parks and our pets and our neighbors, and that we have healthy transportation systems and healthy water supplies. And, we support charities for people that we don't know, because, we give blindly to help others also have the resources they need to take care of themselves. So I think all of those things, kind of infused with humor and with attention and care, I think are the strategies for flourishing. And I think that I'm optimistic that our health system can do this. I am pessimistic that we will have structural governmental or health policy reforms that incent that. It's going to have to come from us individually at this point. And I also think we are also going to have to set some kind of resource constraint on vanity care and on care that benefits some but is not good for all in service of that. So I've been super, super fortunate to work in a health system that I think embodies and values care delivery that is very democratic and universal. I don't think everybody works in that system. And, my hope is that we would move to that kind of values-based and kind of quality focused and less consumer-driven form of healthcare for this country.
Wonderful. It's clear, Ellen, that those values and the ways of your ancestors, the generosity, the organization, the focus, the working with complexity, and the social and emotional intelligence have all created in you such a wonderful healer, we can say, and a wonderful coach and physician. So thank you so much for joining us.
Thank you. Thank you. It was wonderful to meet with you. Thank you again.
Thanks for listening. We will include a summary of today's podcast in the show notes with links to Dr. Ellen Singer. I'd like to conclude by sharing another practical exercise to help you flourish. You can begin by taking a few moments to sit comfortably, eyes open, eyes closed. I would like you to listen to the following descriptions and simply notice what arises in the body, emotionally what arises for you, and also cognitively your thinking experience. The anthropologist Angeles Ariane, whose research drew upon the understanding of 4 archetypes she conceptualized in her studies of indigenous healing cultures, an approach that she called the fourfold way. She described 4 archetypes important to live in harmony and balance with our environment and with our own inner nature. They are the warrior, the healer, the visionary, and the teacher. Because each archetype draws on the deep mythic roots of humanity, we can also tap into their wisdom. When we learn to live these archetypes within ourselves, we will begin to heal ourselves and our fragmented world. The following principles are each based on one of the 4 archetypes: the warrior, the healer, the visionary, and the teacher. And they comprise what she called the fourfold way. So listen now and just feel into these. Show up or choose to be present. Being present allows us access to the human resources of power, presence, and communication. This is the way of the warrior. Show up. Pay attention to what has heart and meaning. Paying attention opens us to the human resource of love, gratitude, acknowledgement, and validation. This is the way of the healer. Tell the truth without blame or judgment. Non-judgment, truthfulness, maintains our authenticity and develops our inner vision and intuition. This is the way of the visionary. And finally, be open to outcome, but not attached to outcome. Openness and non-attachment helps us recover the human resource of wisdom and objectivity. This is the way of the healer. Let me repeat the way of the healer and the way of the teacher as you listen and reflect on the conversation with Dr. Singer. I think her words pointed us all towards those archetypes and those principles. Pay attention to what has heart and meaning. Paying attention opens us to human resources of love, gratitude, acknowledgement, and validation. This is the way of the healer. Be open, but not attached to outcome. Openness and non-attachment helps us recover the human resources of wisdom and objectivity. This is the way of the teacher. I hope you found this podcast and the guided contemplation useful to you, and look forward to having you join us for the next episode of Flourishing in Medicine, From Surviving to Thriving. If you'd like to learn more about EmPro, please visit www.myempro.com. And if you'd like to learn more about our peer support programs, please visit www.myempro.com/peer-support. If you're a physician or student in need of urgent support, please consider calling the Physician Support Line at 1-888-409-0141. And for more information about me and my work, please visit www.mickkrasnermd.com or www.mindfulpracticeinmedicine.com. Until next time.